Sharon Chang, your host.
And I'm Brian Fernandez, your co-host. Now, today on our show, we have two doctors from CVSKL, Dato Dr. Hamdan Leman. He's a consultant cardiothoracic and congenital surgeon, and Dr. Fazir Omar, consultant cardiologist, who will be speaking on how to manage the risk of coronary heart disease. Welcome to the show, gentlemen.
It's a pleasure to be here. Thank you very much for inviting us.
Dr. Fazir, maybe you can share with us how prevalent and common is coronary heart disease, and what do you see in your practice?
Hi, Sharon, thanks. Okay, let me share a screen for my slides as well. Okay, let's have a look at it. Okay. I'm going to talk about heart disease and how to manage the risk in heart disease. Well, before we start, I'm just going to show you a case of what we mean when we talk about heart disease and heart attack. This patient was brought collapsed. He collapsed in Kuala Lumpur and was brought by ambulance. And again, once he arrived, his heart stopped again in our A&E, and we had to shock and resuscitate him. So this is the cath lab. So we have to do a primary angioplasty where we bring him immediately to the cath lab. And this is this coronary artery on the right side, which is quite normal. On the left side, you can see that it's completely occluded, and that's the reason why he collapsed. So that's what we talk, or that's what we mean when we say somebody's got a heart attack. The blood flow just is interrupted, and there's no blood flow, and the heart is, well, dying in a way. What we do in a primary angioplasty is that we put in a wire to the occluded artery, and we tend to suck out the thrombustor. So we use something to aspirate the blood clot. And then we do some ballooning to the artery, and that immediately restores blood flow. And we normally would implant, so when we say implanting a stent, this is what we do. We implant a coronary stent in the heart, and that immediately allows the resumption of blood flow back into the heart. So hopefully by doing this early enough, there is no damage to the heart. So that's where it's important to recognize a heart attack and seek treatment immediately. Again, the blood flow is restored. So oxygen, he's done very well. He was discharged and was followed up in clinic. He's doing very well. And also another patient as well who came in with 4 in the morning, and you can see when the heart is really bad, you can see that his lungs are full of fluids because the failure of your lungs as a heart. So, but he did very well as well, did primary angioplasty and doing very well in clinic. When we talk about the heart is really an engine that beats the moment we are born to the day we leave this world. And when we talk about blockages or arteriosclerosis, it's some form of narrowing that you have in your heart. So when we talk about heart attack, there's an immediate blockage. No blood flow means chest pains, means muscle death, and sometimes you have dangerous heart rhythm. If you survive the heart attack, and hopefully you have a normal heart, but if you don't, you might have a weak heart that might lead you to heart failure. So Malaysia, I mean, heart disease has always been a major cause of top killer for the last many years. And the striking part of it is that in Malaysia, our average heart attack is 58 years old. This is nearly 10 years younger than our most neighboring countries. So it happens earlier. We have seen a heart attack about 20 years old coming with heart attack. So it's not only for the 58 years old average age, you do see the very young ones coming in with heart attack as well.
Doctor, is that because of our diet and lifestyle reasons?
Yeah, because, I mean, we are a champion in the region. I mean, we have the highest amount of rate of obesity in our region, the highest amount of diabetes. So that's the major problem, is the lifestyle. I think we are blessed with very good food. And I think, but I do see a trend nowadays, I mean, especially in this CMCO, that everyone's doing more exercising. I mean, my neighborhood, everyone is cycling and exercising. So I think we need to change our lifestyle and change our diet.
Sorry, Dr. Fazir. Yeah. Those are environmental factors. What about hereditary? So if I come from a family who has history of heart diseases, so how high is my risk factor?
That's a good question. So I think when we talk about cardiac risk or heart attack risk, you have things that you can change and there's things that you can't change. So of course, things that you can change is your diet, your lifestyle, your hypertension, you can measure it,